fits in very naturally, very smoothly for us to bring in an expert who will talk to us about the health effects of these addictions, who will talk to us about our physical, emotional, psychological health conditions and how they prevent us from shining. I'd like us to make welcome Dr. Albert Oguejiofor, who is going to speak to us on the topic shining in good health. Dr. Albert is an internal medicine specialist based in Houston, Texas, USA. He is board certified by the American Board of Internal Medicine, and he is a fellow of the American College of Physicians. Dr. Oguejiofor is a graduate of the College of Medicine, University of Lagos. He's also a member of the Royal College of Physicians of London. He brings 40 years of experience in the field of medicine, and he's going to share with us in, a very intimate way, the keys to shining in good health. Beloved, join me and make welcome Dr. Albert Oguejiofor. Could you please unmute your microphone, Dr. Oguejiofor? Are you able?
Yes, yes. Can you hear
Well,
me?
yes, we can hear you, and welcome.
Thank you so very much, Princess Mokolo. Thank you. I'm truly honored by your invitation. Strangely enough, this is the very first time that I'm hearing that you do something like this. Looks like on a yearly basis. I'm not surprised I'm in Houston, but sometimes I'm always the last to hear of what is going on around me. But I want to thank you most especially for inviting me. It's truly an honor, and wishing you a very happy birthday. Wow, what an afternoon. I like this opportunity, like to take the opportunity as well to thank the speakers that have come before me. Reverend Monsignor Anselm Mwogu, Reverend Father Albert Nze, my namesake, and Reverend Patrick Etuk. I'm a Catholic as well, so it's like what I've heard this afternoon, I've really heard all my life, really, growing up as a Catholic. But, you never get enough of it. It's always fulfilling, always fills the soul when you hear these things over and over again. So my job is going to be very simple because we've heard it all from our Reverend Fathers. What I bring is to bring in the other aspect of life which deals with our medical health. I'm not exactly sure how I will equate that with the spiritual aspect of life, but you will come to find out that they are all intertwined, medicine and spiritual health. Because a lot of times they say when the doctors fail, some people, they say, okay, we'll go spiritual. And almost always invariably, it works. So I'm happy to be part of this presentation today. Now, when you look at medicine, and I'm sure as most of you would already know, there are two aspects to medical health. The first one that you look at is the physical health. When we talk about physical health, we talk about those things that you can readily see when you examine patients and when you run simple blood tests or when you obtain x-rays and other investigative tools that we use in medicine. So that's what we call the physical aspect of health, because you can easily, see what's going on by running tests. But another very significant, if not even most important, is the mental aspect of health. I'll be spending a little bit more time on that. because that is so prevalent, meaning so common in our communities. I'll speak briefly on the physical health. And by the way, I'm not going to keep you all so long so that we don't lose concentration. And perhaps we may have an avenue to take questions. Since I'm talking to a majorly audience that is not of doctors or nurses, I'll try to keep the language very simple. I'll spend a few minutes on the physical aspect of health. And those physical aspects of health, as you're all aware, are very simple things, especially with us in the Black community. High blood pressure, diabetes, stroke, infections, if it's in Nigeria, malaria. So those are all components that we call the physical aspect of health. And of course, when we see patients for the first time, we always try to do what we call a comprehensive or a full physical examination, okay? In this case, the doctor will talk to you to understand what your complaints are. The doctor will ask you about your family history. The reason for family history is that we all know that there are medical conditions that run in families: cancers, diabetes, high blood pressure. So those help us to have an idea of what individuals may be at risk of, okay? And then after that, we'll run simple tests. And then there are preventive measures that we normally like to do, especially for adults. When we talk about women over 40 years of age, we do things like mammogram. This is a tool that is used to detect breast cancers. Now, in men over 40 years of age, especially Black men, we also do simple tests to look for very common conditions in the Black male, like prostate cancer. And those of you that watch the news lately, prostate cancer has been in the news because our ex-president, Joe Biden, was recently diagnosed with prostate cancer. So those are some of the things that we do to screen for these physical conditions. And also, because of the high incidence of cancers like colon cancer, there are also tools that we use to do preventive care and make sure that one is not having early stage colon cancer, or that we're doing things like colonoscopy to screen for that, especially if you have a family history of colon cancer. And then by the time we will take your history, examine you, and run all these simple tests, then we can see if you have high blood pressure, if you have diabetes. And of course, everybody is encouraged to at least have a annual physical once a year to be able to identify some of these common problems, especially these problems that are very, very common in the African-American community. But today, what I want to spend time on is on the mental aspect of health, and something that over the last 40 years that I've been practicing, that I find to be very, very common in our community, and that is sometimes overlooked, okay? I've had patients that will come to me, and this is usually in the adults. It also happens in younger people. And they say to me, "Doctor, I've been everywhere. I've been in Nigeria, I've been to London, I've been all over the place in the US. I have pain in my back, pain in my neck. My heart is always pounding. I have abdominal pain. My abdomen is always bloating. I feel like there's pain everywhere. I feel tired all the time." And the common thing with these patients is they will tell you, "Nobody can tell me what is going on with me." The first thing that readily comes to my mind is that I say to myself, "Listen, I don't think I'm the best doctor in the world. If you have seen all these doctors, you've been all over the place." I remember a lady in particular, all over Houston. She's been all over Houston. She's been to the east, west, and north of Houston, seeing different doctors. I always say to myself, well, I'm not the best doctor in the world. Why is it that all these physicians that you're seeing have not been able to tell you what is going on? And some have always said, hey, you know what, I've gone spiritual, I've put it in prayers. So that brings me to the topic that I want to focus on today. And that condition is called generalized anxiety disorder. Generalized anxiety disorder. I don't know how many of you have heard that term before, but it is it's a very common medical condition. Another way to look at it, in light of some of the things that we have heard today, is when worry gets out of control. When worrying gets out of control. That's another way to look at it. Do you often find yourself worrying about everyday issues for no obvious reason? Are you always waiting for disaster to strike, or excessively worried about things such as health, money, family, work, or school? If so, then you may fall into this category of patients that have this anxiety disorder called generalized anxiety disorder. This is a condition that can make your daily life hell because you're always in a constant state of worry. You're always fearful. You're always dreading that something bad is going to happen to you. This condition is quite treatable, but to treat it, you have to be able to say with a certain degree of certainty that that is what the patient has. Occasional anxiety is a normal part of life. There's no doubt about that. Many people will worry about things such as health, money, family problems. But with people who have generalized anxiety, it becomes excessive. They're always extremely worried, nervous, more frequently about these things that I've mentioned about, okay? It always involves a persistent feeling of anxiety or dread that interferes with how you live your life. It's something that develops slowly. And like I said earlier, patients will be traveling everywhere. They've seen multiple doctors and never really having an answer for their problem. So what I do as an internal medicine specialist is to, first of all, and that's why I focused on the physical health first. First of all, to do a thorough examination, run tests and x-rays as necessary to be sure that you do not have a physical condition that is readily treatable. But in most of these patients, if not all, you will find out that all your tests will turn out negative. Your blood work will be normal, your x-rays will be normal, and then the patient is telling you, doc, what the hell is wrong with me? So, and the thing with this generalized anxiety is that the patients who have it will actually come and manifest. They will tell you symptoms that fit into physical problems. I'm having pain in my back, in my neck. I'm always having headaches. My stomach is always rumbling. I feel bloated. Sometimes I have palpitations. So you see that these symptoms actually fit into physical problems. But when you now examine and run the test, you will never find any physical problem. So that is what will always alert me, when I see these patients, especially if they have seen credible physicians all along the way, that what we're dealing with is not really physical, but a mental condition called generalized anxiety disorder. And without making that diagnosis, you will never make your patients well, and then they will end up losing faith in the doctors, and then they go to other places that you and I know about. So this is, if anything today, I want to make sure that I call attention to this condition, which is very common, and it is really quite easy to treat, okay? But treatment always starts with making sure that you make the right diagnosis. Of course, a lot of the treatment, there are medications that we can use to treat this condition, simple medications, but a lot of the therapy or the treatment involves psychotherapy. Psychotherapy. You have to be able to sit down with the patient and clearly in simple terms, explain to the patient what you think is going on. That is the first aspect of treatment. And then the other modalities of treatment, where we call like cognitive behavioral therapy. Cognition is just your overall brain function, to be able to tell you and teach you that there are ways we can change your brain thinking to be able to handle the conditions that you have. And that is where medical providers like psychologists come in, clinical psychologists, to be able to help and not necessarily focus on medications. We also have other modalities of treatment like support groups, okay? There are people that join support groups where you go in and you see patients who have similar condition, and then you can, therapy, group therapy, talk among each other, and you'll be surprised how common this is, because just when you think yours is worse, you find people who actually have the condition worse than you have, okay? So the most important thing about this condition, because those that end up with me, they always end up thinking that they have something physical. Doctor, I believe that I have cancer somewhere, but nobody has been able to find it. Doctor, I believe that there's something inside my stomach, because this stomach is always rumbling, it's bloated. Sometimes I'm constipated. Sometimes I have diarrhea. I believe there's something inside my stomach. Doctor, my back is always hurting. I believe there must be something in my back. That's when most of these patients end up with me, and we make that diagnosis, okay? So it is a very, very common condition when worry, excessive worry or worry gets out of hand, then we'll call it excessive. And it kind of ties in with a lot of the spiritual things we're hearing today. Do you have belief? And sometimes when these patients go spiritual, prayer, because when they pray, then you're being convinced that, listen, prayer can help you. There's nothing wrong with you. That's actually a form of treatment. So you can see that in medicine, it's a team approach. We need the Reverend Fathers to help us. We need these clinical psychologists to help us. We need individuals who are experienced in these kind of things to help us in counseling. Over the years, I've found out that 80% of my practice, when patients come to me, 80% of the time, that's why they say, when they come to Oguejiofor, they wait for 1 hour. Because one person may come in and take 2 hours. All they want to hear is just reassurance, tell them what is going on, and be able to explain in simple terms what the medical condition is. So I'm not going to take too much of your time. I think I'll leave it open so that we can take 1 or 2 questions if there are any. But please, 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 this is a very, very common condition. Also, in that line of medicine, things like depression come in. And I'm sure you all know that depression is a huge part of this condition that I'm talking to you about. And depression happens to be one of the most common conditions, medical conditions, that we face in clinical practice. But of course, being Nigerian and being used to treating Nigerians, we have this belief that for you to be depressed, that there must be a reason for that. Either my kids are not doing well in school, I'm not making as much money as I used to make, or something bad has happened to me, and that's why I'm depressed, or there are family issues, marital issues. But the answer to that is no. Majority of the depression that we see is what we call endogenous depression. Nobody really knows why it happens, okay? The other aspects of depression that I mentioned really plays that as reactive, you're reacting to something, there's something making you depressed. But these conditions that I've mentioned are just so prevalent in our communities, and it's something that I decided to talk about by bringing up that awareness. Thank you very much.
Thank you so much, Dr. Oguejiofor. Beloved, I would like to invite you, if you have questions for Dr. Oguejiofor, to go ahead in the chat area and put your questions on there. I have a few questions that I already prepared to benefit all of us. And I want to just quickly, jump ahead and ask Dr. Oguejiofor, what are some early signs to warn us, about our heart health diseases like diabetes and even mental health conditions, as you mentioned, as depression, generalized, anxiety disorder. What are some warning signs that we should not ignore?
Okay, let's start on the physical side, like I stated earlier. On the physical side, the warning signs or the symptoms are usually clear, and it depends on what the medical condition is, okay? Of course, we all belong to a society where annual physical examination, meaning people just wake up and say, you know what, once a year, I have to go to the doctor and have a comprehensive checkup. That's not a common thing in our society. I remember practicing in Nigeria, training in Nigeria. So basically, most times the patients only get to us when the disease has already started and is advanced. So what are those common conditions we talk about? Diabetes, for example. Common symptoms of diabetes or sign of diabetes is when you suddenly find yourself, you're always drinking a lot of water. You're urinating a lot. You're hungry all the time. That's when you find these patients, they start to crave for things like orange juice, Coke. They're always drinking it. Okay, so drinking a lot of water, urinating a lot, and eating a lot. So that tells you right away that this is diabetes. Okay, high blood pressure. A lot of patients believe that high blood pressure has symptoms, but high blood pressure is usually asymptomatic. You only find it when you do what? When you go to doctor for a checkup, and he will tell you, wow, your blood pressure is 160 over 90, when normal blood pressure is 110 over 70. Now, those that come down with symptoms of high blood pressure is really when that blood pressure is terribly out of hand. See somebody walking with blood pressure of 200 over 110 when it should be 110. Are you following me? So those type of patients, they may not even know. And that's where the word stroke comes in. Like something struck you. And then they suddenly, and that's what you see in Nigeria all the time, even here in America. Patients say, there's nothing wrong with me. All of a sudden, one day he's struck. He's felled by a stroke, meaning that that blood pressure has now caused damage in the brain. So that's how high blood pressure can manifest, or those in which it's gone on for so long, and then they present to you with heart failure. Doc, I walk a few steps and I'm short of breath. I'm gasping. My legs are swollen. So that's a patient that the high blood pressure has caused heart damage. Again, high blood pressure can cause kidney damage. You see a lot of people end up in dialysis. And then they come in and say, I can't urinate, my whole body is swelling. So physical conditions normally will have symptoms, okay? If you're having cancer in the bladder or breast cancer, can tell you, hey, I feel a lump in my breast, or I'm seeing bloody nipple discharge. If you have cancer in your bladder, I'm seeing blood in my urine. If you have colon cancer, I'm having abdominal pain, I can see blood in my stool. So those are classic symptoms. And when the patient comes, like I said earlier, you examine, you run your test, you can detect those conditions.
What
Now,
about
when
mental
we get
health?
into the mental aspect of health, like I said, with depression or even with generalized anxiety disorder, they will come to you with all these physical symptoms that sound like, oh, it may be high blood pressure. I'm having pain here. I'm having abdominal pain. I'm always irritable. My stomach is always bloated. I find myself gasping for breath. I find my heart pounding all the time. Then you think there's a heart problem, or there's a kidney problem, or there's a brain problem, or there's a liver problem. Then you do your examination, you run all your tests, you run all the x-rays, you don't find anything. And they will tell you, I've gone from one doctor to another. That's when you should, as a doctor, start to suspect that this may well be generalized anxiety disorder, depression, and you start to ask specific questions about their life. Do they have any stressors? Stress can be from anything: work, family, finance, okay? That's what will really tend to guide you towards that specific diagnosis of generalized anxiety disorder or even depression. So medicine is really wide. I mean, you can talk from now till, thy kingdom come. It's really a wide spectrum, but it depends. It takes seeing the physician be able to separate whether you're having a physical problem, which is easy to detect, or whether this is all more of mental issues that are also easy to detect and treat.
Thank you so much. So I'm going to ask you a personal question. As
Yes.
a medical doctor and a Christian, and indeed, I didn't add in your introduction that you are the leader of the Igbo Catholic community here in Houston. So talk to us about the role of faith in the healing process.
In the healing process, right?
Yes, I'm not done. The role of faith in the healing process, and how can churches, ministers partner better with you, medical professionals, to support a holistic approach to the
Thank you.
healing?
That's a very important question. Yes, first of all, let me make a little correction, okay? Like I said earlier, I'm a Catholic, a strong one at that. I am the chairman of the Pastoral Council
Oh,
of,
okay.
of Igbo Catholic Community. So I'm just the chairman of the Pastoral Council. In
Okay.
anything Catholic, we're under the shepherdship of our priests and our bishops, okay? So I'm not the leader, okay?
Okay.
I'm just,
Chairman,
I'm
pastor,
just,
council, Igbo Catholic
yes.
community. So
Yes, we have a shepherd there. We have a reverend father who's in charge
faith
of us. Okay.
and healing.
Yes. Now, when it comes to faith and healing, I think I did allude to that or mention that earlier. Okay. You see, listen, it's a work. It's where we work together in unison. Okay. You can never really separate the two. Okay. The way that I look at it, for us as physicians, not just as physicians, but also as believers, it is God that has given us what? These talents to be able to talk about healing people that we can see physically. And then there are those that God has always told us will always be healed spiritually. So you now find out that is question of belief, okay, and working together. So yes, the spiritual aspect is always critical to us, okay, because anything that will help instill confidence and belief in patients always help what we do as physicians. And of course, we all believe that that talent has been given to us by God. So we work together. There's absolutely no doubt about that. It's not a question of separating the two.
Thank you so much. So, what is that one piece of health advice that every Christian believer should take seriously if they want to live long, if they want to shine brightly as the Lord, you know, has planned for their destiny? What is that one piece of advice?
Well, it's very simple. And I think I've alluded to that again earlier. Simple annual physical examination. Do not wait until you start to experience symptoms to go to the doctor. Like I said, growing up in Nigeria, coming out of Nigeria, and also having practiced in Nigeria for a while. I did practice in Nigeria for a long time before coming out. And I did practice in Europe, in England, in London for a long time before coming to America. You can see the difference in the way that we approach health in all these continents. For us, we wait. When you come to Nigeria, at least back then, maybe I cannot speak about what is going on currently, but back then, if you want to see medical conditions in all their florid natural presentation, meaning how does this medical disease present classically as it is written in the textbooks, you come to Nigeria back then. For example, liver disease, heart disease, kidney disease. And you know why I say you see these conditions in their classic textbook description? Because the patients don't come until it gets to those you see all the classic florid features that once they walk in, you say, this person has liver disease. You can see it right away. Contrast that to some of the societies we live in now, where patients go for annual physical checkup. You don't wait till you get sick, so that these conditions are are identified before they even start to overtly manifest, either when you do blood tests, so that you start to treat them early. You see the difference? So we must imbibe or start to have that culture of having once a year, even if you're not sick, to go to your doctor once a year to do a comprehensive examination. I always like to refer to my training and background in Nigeria. For example, when I worked in one of the teaching hospitals in Enugu called UNTH, University of Nigeria Teaching Hospital, this big, beautiful building that was built then, it was called Beautiful Complex. It was called 140 bedded. 140 bedded means that that complex had 140 beds. And I'm talking about 1985, 86, 87, 88, 90, when I was there, 91. It was called 140 bedded. Now in the community in Enugu then, anytime anybody outside, any family, hears or heard that their family member, their loved one is admitted into 140 bedded, everybody starts to cry and wail. And because, you know why? Because if we admit 100% of patients in there, only 25% will come out alive. So it was a thing that was dreaded, who have been admitted into 140 bedded. And the reason for that was because patients were coming with terminal diseases. You see, cancer has spread all over the place before they get to the hospital. You see that the kidneys have failed when we did not even have dialysis. You see that the liver has failed because nobody ever presented. And of course, you can't blame the patients. A lot of them were brought from the surrounding villages. You see heart failure that is at its terminal stages. So the chances of survival were very, very, very minimal. So that's the message. If you're in a society, not even any society at all, including present day Nigeria, make sure that you get an annual physical exam. What is a physical exam? You're going to come in, like I said earlier. The doctor will talk to you, Princess Mokolo, how are you? Any complaints today? Any family history? Do you smoke? Do you drink? Do you use drugs? Do you drink excessive alcohol? Followed by, that's a history taking, followed by examination, and then the ordering of simple tests. And then they can tell you, these are the medical conditions that you have. But of course, focusing on the generalized anxiety disorder, depression that we talked about, you're not going to find anything because everything is going to be totally normal. So that is the message. Simple annual physical examination.
Thank you so much, Dr. Oguejiofor. We have been so blessed and enriched. And indeed, beloved, I'm convinced that if we pay attention to our health, we can shine as the Lord will have us shine. God bless you, Dr. Oguejiofor.
Thank you very much.
See you again.
Any questions from anybody?
I checked in the chat area. I didn't see anyone. Did I miss? If you still, one more chance. Does anybody else have? I have someone who says she has not heard of generalized anxiety disorder before. And that means that our job is done because basically our goal to bring it to everyone's attention. But I think you've done such an awesome job. There are no questions. All the students have passed.
Thank you very much. I just want to be sure that nobody was sleeping while I was talking, but it's not unusual. Everybody that I talked to with this condition, they've never heard of it before. Of course, they're not doctors anyway. And of course, unfortunately, I also have to blame some of my colleagues, who don't really spend time to talk to patients. And a lot of physicians would make the mistake of saying, well, even if I explain, they will not understand. No, you have to let the patients know exactly what you're thinking, because by understanding, that's always the beginning of healing, when the patient can understand what you have explained as what you think is going wrong. But it is very common. I see it all the time.
Okay, so just a minute. I have one person. Go ahead and unmute yourself. We have one person with a question. Unmute yourself and ask your question. And just to give us an idea of where we're going right after this, I'm going to bump the program a little bit. I'm supposed to give a presentation on shining in this 21st century, but I'm going to allow Father Ralph Obiche to give us his presentation on You are a city set on the hill, leaving as a city set on the hill, and then after that, I'll come back. Don't be in a hurry. We do this once in a year. And I pray that everyone under the sound of my voice will be truly blessed by this. Go ahead and ask your question, Mr. Tony.
Okay, thank you.
Yeah.
Um, Thank you very much, Doctor. It was a very enlightening speech. I just have one question with reference to, because you did allude to stress being one of the causes of a lot of the issues that we tend to have. I just want to, what are some of the ways we can manage stress? People in my generation, we tend to hear about things like mindfulness, meditation, and all those sorts of things. What's your take on all those practices?
Okay, I'm not exactly sure that saying that stress is a cause of the conditions that we've talked about, okay? But we do know that stress is one of the major factors that will exacerbate or make worse this condition in patients who are predisposed to having this condition. For example, either in patients who are already genetically predisposed to having this condition. And that's why you talk about, we always take a family history in every patient that you see. Ask them about their family history. What kind of physical problems have they had in their family? So it will not be correct to say that stress is what's causing it. But stress is one of those conditions that can exacerbate it, okay? Of course, when you talk about how do you manage stress, if that is what I'm understanding, it's going to depend on what you really believe is causing your stress. Because unless you address it or you face it head on, excuse me, or you face it head on, you're not going to make any headway with management. We all know what stress is all about. I get stressed all the time. You know, sometimes I come in here, I have to see 30 patients. Before I walk in the door, I'm already stressed, okay? That's one form of stress, work-related stress. I see patients who do shifts. Excuse me, I've had a cold. I'm trying to get over a cold. I see patients who do shift work. There's also what is called shift work-related stress. What is shift work? Patients who do night shift. And they have to intertwine that with their daily living, okay? So shift work has its own related stressors, okay? There are financial stressors, there are domestic stressors, including family, marital, children. So you have to identify what your stress is and be able to formulate a way to manage it. And most patients will make the mistake of trying to manage it alone, not knowing that there are counselors that can help, okay? So stress and management just really depends on what it is and to be able to get the best help that you need. But you all know what I'm talking about. There's so many things that can cause you stress.
Well, thank you.
Does that answer the question?
Mr. Tony, did he answer your question?
Yes, to an extent.
Okay, so I want to promise you all, Dr. Oguejiofor will be back. He's going to come back, and we're not going to wait for an entire year. Him and his colleagues will come back. We'll have segments that will address different health issues. And I'm already committing him. But just quickly,
Yes.
some persons want to know how to handle, situations that involve mental health checks, considering, the level of stigmatization, the stigma
Yeah.
that surrounds depression, anxiety. How do you handle, checks, comprehensive health checks, medical health checks in that medical sphere?
Right. Like I tried to allude in when I gave my presentation, this is a very sensitive subject for Nigerians. You all know what I'm talking about. Nobody likes to admit it, and that's why a lot of Nigerians go undiagnosed. Nobody likes to talk about it because they always believe that depression or mental illness is some crazy thing in our cultural belief. I'm Igbo. A lot of people don't believe that there's anything like depression. Because to be depressed, they have to feel that you're not doing well in business or something. So this is a common problem, and I'm glad that we're talking about it today. So it takes you going to the doctor. I'm an internal medicine specialist, so I specialize in physical issues, but we are also the gatekeepers in the management of adults. So it's our job to identify mental illness when they exist. And some of the more simple ones we can deal with in the primary care office. But of course, if we think it's a little bit more severe or that you need specialist help, that is where we will do what? We'll get you referred to a psychiatrist or a clinical psychologist, okay, or a psychotherapist, okay? So I'm not saying that we manage everything. I'm internal medicine specialist, but it's our job to make those diagnoses, okay? Just like I would diagnose kidney disease and kidney failure and send to a kidney specialist to take over, or that I would diagnose heart failure, congestive heart failure, and send you over to a heart specialist to take over. Just like I would diagnose a very bad knee and send you over to a knee specialist to see if you need a new knee. Likewise, I would diagnose mental illness and then be able to send you to the right psychiatrist or a clinical psychologist or a psychotherapist to help you. Are you following me? So I'm not saying that we'll do it all, but that is the way medicine works generally. But it's a very sensitive topic. It's cultural. Nobody wants to hear it, but you got to be blunt. You got to be honest with the patient and say, this is what it is. You have generalized anxiety disorder, not because of stress is one of the things that make it worse, but that's not necessarily only because of that. It's not because you're having marital issues that you're having generalized anxiety disorder and your stomach is always bloated. It's not because your kids are not doing well in school. It's not because your kids are into drugs. So you have to be able to talk about the subject openly and let patients know that these things exist, not just in Nigerians, all over the world. Like I said, I've practiced in 3 continents. It's the same thing: Africa, Europe, America. So we have to learn, and we're coming to that as Africans, as Nigerians, to know that there's no taboo, there's nothing wrong with talking about these subjects because they exist. So that's one barrier that we have to break through and let people know that these things are there and that they're so easy to treat, and nobody should be stigmatized for having such conditions.
Thank you so much, Dr. Oguejiofor. We will come back and we will emphasize mental health conditions, and we will, by the grace of God, spotlight, ways to enlighten the community about destigmatizing mental health condition. Beloved, I promise you, we will make an agenda of destigmatizing mental health conditions. We will do it one speaker at a time. Thank you, thank you, thank you, Dr. Oguejiofor. Is Father Patrick there to give us just one very brief interlude as we make welcome our next speaker? If Father Patrick is there, let's get ready for Father Rob's session. As Father Patrick gets ready, let me just quickly read Father Rob's profile so that we'll bring him on. He's a priest of the Catholic Archdiocese of Abuja. He is the parish priest of St. John Paul II Catholic Church, Guzape in Abuja. He has a music album to his credit titled Awesome Grace. He has worked as chaplain of Christ the King College, a formal secondary school of the Archdiocese of Abuja. He's going to be talking to us about how you and I are set on it. But just before that, let's take a listen. Let's worship. Amen.
When peace like a river attended my way, when sorrows like sea billows roll, whatever my Lord has taught me to say, and it is well with my soul. It is well with my soul. It is well with my soul.
Father Rob, take it away.
It is well with my soul. well. It is well with my soul. Praise God. The Lord is good.
All the time.
Yeah, the talks this evening have been so refreshing, just to, to make reference to Dr. Albert Oguejiofor. This is given to us in such a refreshing way. And I just saying in my mind how I wish thousands, lots of people are here. The impact is going to be amazing. But I just feel like, very thousands of people who are going through these conditions you're talking about now. They say knowledge is power. They are able to, to hear some of these, and I'm particularly refreshed this evening, Dr. Albert. I'm really so impressed and happy. And also listening to Father Patrick Etuk from the psychological dimension, I was also very much refreshed. So there is so much of professionalism in what's happening tonight. And what it means is that God is interested in integral well-being of the human person from every angle. And if we pursue all of these from every side, you discover that we can't miss the target. So I'm so happy that we have foot soldiers from every angle. If it is air battle,